Hey, that was fantastic.
Hi.
I love when like healthcare providers are actually patients because
I was going to say it does help because we know the ins and outs and we know some of the secrets. It definitely makes it a lot easier because when you're not a patient, you don't know, all the secrets about like which are the best compression pants to use. And, like personally, I don't think liquid IV tastes great. It's got way too much sugar for me. So like I'm an element tea or an element. I always say element tea, but apparently it's pronounced element user and things like that. So I can like I will tell people like if you're a sugary drinker, like go for liquid IV, but like
which
I can't handle the sugar or like
so I also have POTS, infection triggered POTS. What was I going to start with? So actually I'll start with some questions first. And let me put context in case people aren't fully aware that. So we do know that COVID is triggering POTS in some patients. In the adult population, depending again on the study, it's up to like 87% of people have long COVID. Yes. And once again, this is a limitation of lack of pediatric research. We don't know. But
we know we're seeing more. We know
we're seeing more. And I will tell you in our patient population, so long COVID families right now, I think we have like a community of about 11,000 right now. One of the primary symptoms that gets reported is POTS like. I can't tell you it's a POTS symptom because they haven't been evaluated, but it's the dizziness and the headaches and the descriptions of blood pooling in the leg, that sounds like, and kids will talk about pressure or feeling in their chest. And there was a presentation by caregivers that we did on day one. And both moms had like a 4 and 5-year-old, and they were describing POTS symptoms. And I just want to point that out because it used to be said that kids under 12 didn't have POTS. I just want to put it out there. We're seeing the symptoms of
yes,
it.
And like we said in our slides, kind of in the pre-COVID era, it was very much considered a post-menarchal or kind of like a puberty-related illness. And it was very much considered to be related to hormones. So we wouldn't think about it in being much younger than 12. Maybe occasionally like an 8 or, like a 10, not even an 8-year-old, but like maybe like an 11 at youngest 10-year-old. But like that would be really, 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 really rare, because we previously really thought it was related to these hormones. And then you get a pandemic. And a pandemic changes everything. And on top of that, COVID has just changed everything. COVID's turned medicine on its head. So you can never tell with COVID.
That is true. All right. So some questions our community had for you. So I think you went over this a little bit in your presentation, but can you go back and reference what are some behaviors parents should look out for that could actually be POTS?
So, and this is going to vary from depending on what age your kid has. With your older kids, you're going to see, you can see fatigue. You're going to see definitely exercise fatigue. So you're going to have, if you've got an athlete who was a great runner or, had great exercise endurance, all of a sudden they're going to have that exercise inability. You are going to see, we talk about brain fog. I hate that term. That is like way too nice of a term for what it is. You might see their grades falling. You might be asking them to go do something and they forget to do it. And you feel like you're being ignored and they're not really actually ignoring you. Like they're really actually struggling. You might find that they're talking about like feeling really dizzy. They may talk about chest pain, shortness of breath. They're going to actually tell you your symptoms. Your older kids, you're 12 and up, they're a lot easier because they're actually going to verbalize your symptoms. Once you're hitting like 8 and younger, you're having a little bit of harder time because they don't have as clear of a capacity to walk up and be like, I'm dizzy today. It hurts when I run. Then they're going to be a little more creative with how they explain things. So that's where you're going to get things like I'm on a boat. Or, it's really, I feel like I'm rocking. Or you're going to start seeing them drop things more, or kind of walk into walls and seem a little clumsier. Or just, you're going to have that kid that was like walking really well, seem like they're not walking so well anymore. You're going to have kind of that, and, that 5-year-old that seems like now they're kind of like walking like a 3-year-old kind of thing. So if you feel like your kid's regressing in milestones, that's always a red flag for me. Any kid that is not, especially younger kids, that doesn't seem to be keeping up with their friends energetically is always a concern to me, whether that's POTS, ME/CFS, or anything else. If they're not keeping up energetically with their friends, and they were before the infection, that is a concern to me. That is a kid that needs to be evaluated. And that's across the board. This is the toddler that didn't used to want a nap and is now really loving their naps. This is the kid that is, used to run and play with their friends on the playground, and now all of a sudden just wants to sit on the playground, those types of things. We talked a little bit about they're not eating as well. You can have GI symptoms with POTS. So you want to monitor their nutrition and how are they eating? Are they seeming to get full really fast? Are you happy to
follow up specific
Yeah.
about the eating? Because we have a lot of our children that are being told that it's an eating disorder. Right. And so I just want to clarify this, because we've had families have to fight with their doctors to be like, no, it's not an eating disorder. And the child say, no, I want to eat. It's just, can you talk about that a little bit?
And that is where you're going to have to really kind of pull to figure out, is this POTS or is this neurological damage in terms of like, are they having issues with like dysgeusia where things taste bad, smell bad, they want to eat, but it doesn't taste good, so like, is that the issue? Or are they getting full fast? So like they eat and they take, they eat half of what they used to and they're telling you they're full. Because like with a POTS kid, you're going to see them eat like a much smaller meal and be full and talk about being bloated and having diarrhea or having constipation. And that would be more of a POTS picture. A kid who is like telling you they're hungry and then takes one bite and like pushes it away and is like, never mind, I'm done. That I would be more worried about, like issues with smell and taste. And that's a different road. It's still a concern. And it's not an eating disorder. It's a neurological issue. And it's not the child's fault. And it's not going to be fixed with behavioral changes. Both are concerning. And both the child needs help, and both are, absolutely COVID related, and not at all in the parent's mind or in the child's mind. But they're very different treatment paths. So you need to kind of really kind of suss that out. And that's going to be a little hard to do in the beginning, especially depending on the age. With your 2-year-old, that's going to be hard. So give it some time. If you can't figure it out the first day, that's okay. Like no parent will. So, just kind of really trying to suss out, look at those clues of like, are they eating, but they're just getting full quickly, but they're eating a variety of foods? Or is it like, we have one safe food and they're asking for food, but like we can only eat one food and it's a bland food? Then we might be having a sensory issue. Like everything might smell and taste bad, kind of thing.
Actually, I have a question here from the audience. Is it possible to be born with POTS? I have personally had symptoms my whole life. Looking back, I'm curious from a doctor's perspective to hear about, or from a nurse practitioner.
So honestly, I have never heard of somebody being born with it. I will never say never in medicine, because we don't know enough about the human body. So I'm not going to say no. I'm gonna say that often it's something that's triggered. I think there's probably a genetic component. So to say that you couldn't be born with it, if there's a genetic component, I wouldn't see why that's not, possible. To say that it's, not something we see, um, it's not something I've run into, but again, that doesn't mean that that's not a possibility. I haven't seen it or met every person in the world. I haven't taken care of every patient in the world. So I'm not going to say no. I'm also going to say, I think that when a lot of us with POTS kind of look back, there were signs like, oh, like even as a kid, like I had X, Y, and Z. So like it may have been like there was like low levels and then something triggered and it became full blown for some of us. So for some people, those low levels may have been less low, like everybody may have had a little bit of a threshold and then it got more triggered by whatever your trigger was, viral, concussion, puberty, the sun coming up one day, whatever you want it to be. And so I'm going to say we don't know enough yet, but I'm not going to say no, because I will never say no in medicine, because if you say no in medicine, you're going to be proven wrong.
Let's see. Next question. What are some ways to explain POTS to young kids?
Oh, that's a great one. So again, kind of depends on your age. So I have a 4-year-old, and I've kind of just explained to my daughter, now specifically mine has been COVID related. So I said to my daughter that we have nerves that run through our body that I've been kind of point blank with her, that send signals and tell our body to do things. And I've said things as simple as my body told my arm to go up. And that was a nerve that my brain sent a signal to my arm and my arm went up. And some nerves do things that we don't even think about. I'm breathing right now. Nerves are telling me to do that. And sometimes our nerves go a little wonky and they don't always get the message right. And so I say to my daughter, mommy's nerves, when mommy got COVID got mommy's nerves a little angry. And mommy's nerves don't always know what they're doing right now. Their wires get a little crossed. So sometimes when mommy stands up, mommy's nerves go, don't stand up. And so we talk about things like that. And we'll talk about my symptoms. I'll go, oh, mommy stood up and mommy's body's not ready to stand up. Or she knows that mommy takes stand-up medicine and things like that. So we make it kind of playful. Now, if it's a kid who has POTS, like a younger child, like a 4 or 5-year-old who has POTS, I would also kind of explain it that way. But I would, kind of do it in terms of like how they feel. So I would ask them, what does it feel like when you stand up? How does that feel in your body? And then I would listen to the words they use, and then I would try and kind of use those words in the explanation. So how does it feel when you stand up? And if they say, I feel, spinny, we'll say, your nerves get a little spinny sometimes. So your nerves are spinny. When you got COVID, the COVID got in there and they made your nerves all spinny. And so now when you stand up, you get all spinny. And that's why we drink this water, so that your nerves don't get this spinny, because it's not always fun to feel spinny. Sometimes it's fun to feel spinny, but not always, right? And just try and try and meet your child where they are developmentally. So like, that's what I would do for my younger kid. Obviously with my older kid, I would be a little bit more like, let's talk a little bit more about the pathophysiology to where they are and why we need to do what we need to do. And with your teenagers, they're going to get tired of taking the medication. They're going to get tired of this regimen, because I get tired of it. So they're going to get tired of it, and be upfront with them about that too. This is a lot, and it's unfair. You have to do this and your friends don't. And it's okay to be mad about that. And there are going to be days when you want to skip it. And if you skip it, you're going to feel worse. And that's fine. And that's your choice. But then notice how you feel when you skip it. And when you have a really bad day, you're going to have to remember why you felt that way. And that's a good reminder as to why you need to take your medication, or why you need to drink your water, or why you need to wear the compressions, or why we're doing X, Y, and Z.
Yeah, I went through that whole phase myself. You learn.
I'm still going through that phase some days.
You learn. You learn. Your body will be like, nope. So next question. What kind of support do you think would be helpful from extended family members?
So that's gonna be, I think, personal to each person, and each situation. And I think, I think the biggest thing is you need to figure out what that is for you. And then I think you need to make that boundary and kind of, I'm going to say, so I've been in therapy because this is a whole big life change, and it requires therapy. I recommend it for anybody and everybody. I just think it's a great thing. And my therapist kind of said to me, set up your boundaries as factual as saying the door's right there, the sky is blue, the car is red, and just make the boundaries very blatant. So like for me, we're a big masking family because my daughter has long COVID and I have long COVID, and we don't want to get sick again, and that is our personal choice. And so the rule is, if you come into our house, you wear a mask. And some of our extended family doesn't like that, and we've just kind of said, hey, we will love to see you, we can see you at your house, and we will be in masks. We're not going to ask you to wear a mask at your house. That's your house, that's your area, that's fine. But if you're coming into my house, this is my safe space, and the rule is you walk in the door, you wear an N95. That's the rule. The sky is blue. So I think you find what is it you need from them, and you make the statement, and you make the boundaries that you need to make. If it's when they come, you need them to have shorter visits or need breaks, for your child, you can't let the whole family come and your kid run around the whole day. Your kid needs a 2-hour break at this time and an hour break at this time, and the family needs to leave the house, otherwise the kid won't lie down. Then you say, you guys are welcome to come, and at 1 o'clock you guys are going, and you are welcome back in the house at 3. The car is red. And this is what we do for our family. I'm sorry if it's upsetting to you, but these are the rules of our house. Yeah. And you just kind of lay it out that way.
That's great advice. It's really the only way you can do it. Well said. Thank you. Next question is, my child's doctor isn't knowledgeable about POTS and implies it's normal kid stuff. How do I get them to take my concerns seriously?
That is tough, and I am really sorry about that, because that is not an uncommon thing, and guilty. I wouldn't have said it was normal kid stuff, but I was not. I knew I wasn't knowledgeable about it, but I was not knowledgeable about it before I had it. So we, there's a couple things you can do. You can look on our website. We do have some information on our website. You can try and bring it in. Again, we don't have it pediatric specific, but we're working on that. You can always try for a second opinion. I know it's a pain, and it's not always a possibility to switch doctors. And so I know that one's a really hard one to do. The other thing is the symptom tracker. Sometimes if you come in with the symptom tracker and be like, these are the things we are seeing, This is what my child was like pre whatever your child's trigger was. You're here, so I'm going to assume it was COVID. Pre-COVID, this is what we're seeing now. Even if you're not going in and saying it's POTS, just going in and saying there is something different about my child since my child had the infection. There is something that needs to be investigated. Here is the picture of my child before the infection. Here's the picture of my child afterwards. Here's our symptom tracker. Come in and be like, I need you to understand that there is a difference. There's a marked difference, and here is my proof, and try and give it to them that way and be like, and maybe try not to come in and give them the diagnosis. Some doctors, ego gets involved, and they
get sensitive
that you're coming in and giving them the diagnosis.
That's the right word, but
ego gets involved. But coming in and saying, here is the evidence that here are the symptoms, there is something wrong with my child, they may at least start the workup. And in the meantime, you might start looking at our website to look at like supportive care things that you can do at home just to help your child.
Yeah, I'd really recommend looking at the website for sure. Another question just came in. Is there a way to make schools safe for children with POTS or long COVID diagnosis?
I mean, as safe as we can. Ideally, there would be bubblegum. So definitely you want to work with, if you can, hopefully you have a good medical provider on your team you can work with. You want to get, some, I'm sorry, I'm having a brain fog moment. What is the word? Ideally like an 504 IEP type of thing.
IEP, yeah.
But some accommodations. You definitely need a note for a water bottle. You need a note to have salty snacks, or if your child is going to do any sort of salty thing in the water bottle, because they're going to flip out if it's not just water in there. You need a note to allow them to move around the classroom. You need a note that they can go to the bathroom, because if they're drinking water to the amount that they should be, they're going to need to pee more than the average kid. They need to be allowed to go to the bathroom. I personally have written those notes
because it's just such a pain. They won't. You have to have a note.
You do have to have the note. I have written those notes. You're gonna need a note for that. If they have diarrhea from POTS, you're gonna need a note because of that as well. You're gonna need a note for, depending on how they do, are they old enough to be in PE? You're gonna need a note for that. To whether it's to get them out of PE, or depending on how bad their POTS is, adjustments for PE, a note that they're in physical therapy. So, let them do their physical therapy during PE. Ideally, if you could get a note for adjusted for assignments and time for them to be allowed to go lie down in the nurse's office, extended time for tests, things like that, all of that, they really need a fairly extensive plan, honestly. Even depending on, if they're like middle school and high school and it's like a multi-level school, a key for the elevator is a good one.
So can we pause there for a second? Because a lot of our kids have a hard time getting access to it. I don't know why they gatekeep that key to the elevator so firmly. So the medical provider needs to explicitly state that they need it, even if they can walk.
Yes.
Because that needs to be in the notes. That's just a quick tip, because we've had many people in the office deny it because they can physically walk. And so just to clear up the multiple back and forths that will happen, just have the doctor write, even if they can walk, they should be able to use the elevator. Because one of the hardest things to do if you have POTS is walk upstairs.
Yeah. Oh, absolutely. That's the fastest way to get your heart rate way high.
It's really hard.
And they Another one, if they're in high school or middle school and they have to go between classes, extended time to get between classes, because sometimes just rushing from one class to another, that's going to get their heart rate up real well. So they may need to leave their class 2 or 3 minutes early, and they need to be allowed to get to their next class 2 or 3 minutes late. They may just need a little more time. So just things like this really are going to help them, because otherwise school is the exact opposite of what pacing is. I mean, it's
Right.
School is not set up for a kid who needs to pace at all. So these types of things, and this is a great thing, because I'm the one who's working on the pediatric portion of the website. So this is something that I'm going to make a note after this, and this is going to be something that I'm going to think about and try and write up other things to ask your providers for pacing for school.
So we have one more question, and it says, do you have any pot secrets you've discovered on your journey that you don't see talked about enough?
Oh, trying to think. I feel like I don't see talked about enough. It's so funny, because after a while you kind of think everybody knows things, and then you realize that like it's a secret and you didn't realize that people didn't know this. So it's so hard to know what like people don't know that you don't realize.
I'll share something while you maybe consider all the things you've learned recently. Yeah. You learn stuff real quick. But I first developed POTS when I was 11 and I didn't know it. I would say the thing that's not talked about enough is your inner thought process about your own symptoms. So if you start feeling tachycardia and your response to it is, here we go again, this doesn't feel good, I'm never going to feel better, and you kind of have that, I can't say the word correct, catastrophizing, you know the word,
yeah.
Approach, it actually will trigger your fight or flight more, your symptoms get louder, it feels worse. And so, like, I'm certainly not trying to say that like changing your thoughts is going to change the symptom. It will change, but it helped me, the symptom never changed, but it helped me manage the symptom and have a better quality of life. Because now, instead of saying, oh my gosh, here we go again, what is that? And I get panicky about it, I simply say, okay, well, do I need electrolytes? Do I need to sit down? Like it's my body signaling that it has a need is now how I think about it. My body signaling a need. How can I help meet the need? And that is, so it's signaling need. I can check at this point, I know to check in, and I'm like, do I need the electrolytes? Do I need to sit down? Do I need to rest? Am I overstimulated? Those are usually my big ones. Or do I have a migraine? That's a big one too. So it's like, those are kind of my check-in points. And then each one has an action I can take. And so maybe I just sit down, maybe I get water, all of that. And then it's just kind of done. And the symptom kind of starts getting quieter as soon as the need is met. And it's just a better quality of life.
Yeah, definitely.
Than what I used to have, which was more of a like, well, it's because I didn't know I had POTS too.
Yeah.
So it was scary.
I think kind of along the lines of that is, in the beginning, you spend so much time fighting your body and fighting your symptoms. And it's actually the hardest thing to do is to learn to trust your body and almost actually trust your symptoms. And this is going to sound weird, but almost befriend your symptoms as a warning sign. Like, I get tinnitus so my physical therapist and I have ranked my symptoms as green, yellow, and red. And I have certain symptoms so like my green zone is like, I'm really doing fine. Like, I can do whatever I want. My yellow is like, all right, I got to keep an eye on this. Like, I can keep going, but I've only got like a couple more moves left, and maybe I need to go lie down and put my legs up. that, you know, maybe I need to start pounding the water. Am I getting too hot? Maybe do I need a cooling towel? Do I need to put cold water on my hands, splash cold water on my face, that kind of stuff. And red is go lie down now. You're done. Call it a day. That's it. Red flag. We're done. Play's over. And like, so like tinnitus is my like yellow, like, okay, you know, I hear, like, you know, when my ears start ringing, it's kind of like, okay, I hear you. Like, my nerves are starting to yell at me. Like, we're getting there. I know, like, I'm pushing my body too hard. Like, I can put 2 more dishes away and I got to go sit down. Like, we're almost done. So it's a little bit about learning to, and with your younger kids, you're not going to be able to really teach them that, but with your teens, helping them kind of learn to rethink about how they view their symptoms.
Yeah.
And not view them completely as the enemy.
Right.
But sometimes view them as the warning signals and view them as a guidance. And then also the other thing for me was, I think probably the weirdest thing that nobody ever really talked about in the beginning for me was the temperature stuff. So like I knew there was temperature instability, but like the first 2 summers, I would get chills when I was hot and I would sweat when I was cold. It was completely backwards. And the first 2 summers, it had me so confused. And my husband had to tell me when I was getting overheated. Now I can kind of like look at like my watch, or I can feel my heart rate and I'll be like, oh, I'm hot. My heart rate's going up. I must be hot. But like, I didn't know I was getting hot anymore. It was the weirdest thing.
Yeah.
And nobody forewarned me that was a thing. I didn't know that I was going to sit outside in 95 degree weather and not know that I was hot. And that will actually throw your pots really off. But nobody told me that that was going to be a thing. So like teaching your kids to like figure out that they're hot, or like helping them know that you might be hot and you don't know it.
It's actually a huge impediment to identifying these syndromes in children. Is like, even as an adult, you experience, like, half the time I don't even have I mentioned in another talk, half the time I don't even know I have a migraine until I get very irritable. And then my husband tries to nicely suggest maybe I check in with myself to see if I have a migraine. And it's usually, yes, I do. But there's something like there's a disconnect with the symptoms sometimes. And I think that's particularly true where children will just look like they're having kind of a meltdown because they don't know that they're hot. Like they don't really,
or that their heart's racing,
or that their heart's racing, or that they just don't feel good. You know, it's like they don't know they're tired. You know, they just kind of,
they don't know. They just know they're dysregulated.
Yeah.
And they don't know what that means. So they're just gonna melt down. And so with your toddlers, and it's hard because toddlers have, like, my 4-year-old right now is having meltdowns every like 10 minutes because school's getting ready to start. Our nanny just stopped, you know, big life changes. So she's having a ton of meltdowns, and that is normal for her. So it's hard to know, is this normal? Toddlers having all sorts of meltdowns, or do I need to start worrying that she's got POTS? But, you know, we're going to continue to monitor her. We're going to get her through the start of school. And if this continues for a long time, I'm going to start worrying. But like, if that happens for a long time, you know, it may not just be a behavioral issue. It may not just be regular, you know, 4-year-old craziness. It might be that there's something medically wrong. So like, if you're finding these kinds of things with your kid and your kid is just like constantly melting down, there may be something else going on there. They may be wildly dysregulated internally because their nervous system is dysregulated.
Yeah, well, POTS is a form of dysautonomia, which is dysfunction.
Dysregulation, exactly. Yeah. And a 4-year-old can't be like, and even me, like, I laugh, you know, I get irritable all the time, all of a sudden. And I have now learned that if I'm irritable, I still don't even know what's going on, but I know I need to go lie down. And so like, if I randomly snap at my husband will look at me and he goes, do you need to lie down? And I'm like, apparently. And he goes, what's wrong? And I go, I don't know. And then like later I'll be like, oh, well, my heart rate was 140. That's what was wrong. I don't know why my heart rate was 140. I didn't know my heart rate. I didn't feel like my heart rate was 140, but my heart rate was 140. Who knew?
Thank you for joining us. That was really good. And I think it was like really useful information for families. I appreciate everyone for attending. We will be sending out the links next week with all the resources as well. All right, everybody. Thank you very much. Bye-bye.